which means it's time for Clarion Connection with Ron Wilshire. Good morning, Ron.
Morning, Steve. How are you doing?
Fine, thank you. How are you doing this morning?
Great. We have a kind of special program for us today on Clarion Connection. I'm going to be talking with Brian Duke, the Pennsylvania Secretary of Aging. So we're going to be talking about a meeting that they have planned for Clarion on Alzheimer's. Governor Tom Corbett issued an executive order creating a committee to create a plan to address Alzheimer's disease and related brain disorders in Pennsylvania. And Clarion is one of a number of locations that has been scheduled for a meeting to discuss Alzheimer's, talk to caregivers. And the Clarion meeting is scheduled for Monday, September 16th from 9 a.m. to 12:30 p.m. at Clarion Hospital. And we have Secretary Duke on the line. Good morning.
Good morning. How are you, Ron?
Great.
Good to be with you.
Great. Do you want to tell us a little bit about Alzheimer's and what exactly it is? We occasionally all joke about having senior moments and forgetting things, but Alzheimer's is something much more than that.
Well, when we think about Alzheimer's, we think about a condition that could be considered both a chronic disease, also a terminal disease. It's a disease that affects the lives, we believe, of almost every Pennsylvanian. You know, the loss of ability to recall, you were talking about memory, certain things, eventually can lead, as the disease progresses, to a loss of certain abilities to communicate, abilities to take in nutrition. And we know that Alzheimer's is often accompanied by other diseases and conditions, illnesses that impact a person's longevity as well as their quality of life as they live it. And so it is indeed a devastating disease. It's best diagnosed by a team of physicians, usually who involve a neurologist, primary care physician, and others who come to the conclusion that Alzheimer's disease may be a very real reality in a person's life, and then communicate with the family member and the person living with the disease about how they continue to live with the disease.
Earlier this year, Governor Tom Corbett issued an executive order creating the Pennsylvania Alzheimer's Disease Planning Committee and named you as chairman of the group. What prompted the governor to issue an executive order?
I think there were several factors. I think one is the governor's realization that, as I just offered, that we believe Alzheimer's disease touches the lives of many in our state. It's almost a growing crisis. We're the fourth grayest state in the nation when you look at the percentage of population over the age of 60. And when we look at that, we know that there's a growing incidence rate of Alzheimer's disease among those who are older, right? Alzheimer's disease does affect some persons who are younger. There's information out there about people in their 40s or 50s who have Alzheimer's disease or have been diagnosed with it. But we know for the most part it affects those who are older. And that's one reason our governor was concerned about it, because he knows that it's affecting so many Pennsylvanians, and there's a need to respond. Pennsylvania Department of Aging offers services to help our fellow citizens, but he knows that there'll be a growing need and demand for service, and because of that, because of his concern for the people of the Commonwealth, he signed that executive order. Another reason is members of our legislature had concern at the same time. They had voiced concern in the chambers of the General Assembly about Alzheimer's disease. As a matter of fact, there's an Alzheimer's caucus that exists in the General Assembly of Pennsylvania. And there's great concern among our legislators as they see constituents who are living with the disease and the impact on not only the persons themselves, but their caregivers as well. That was a second reason. And the third reason is I think Governor Corbett has expressed his commitment to older Pennsylvanians through the provision of home and community-based services, who is successful in the governor's proposed budget, which was passed by the legislature and signed by our governor, to make sure that home and community-based services are available to our citizens to help them not only for the diagnosis of Alzheimer's disease, but for other needs they may have as well. So they're the reasons I believe Governor Corbett signed the executive order calling upon us to move forward in a planning effort.
I know some estimates place the number of Commonwealth residents living with Alzheimer's disease at 280,000, and then when you add in those that are living with related dementias, it could go up to 400,000. So that's quite a few people in Pennsylvania.
That is a correct. Yeah, they are the numbers offered to us by the Alzheimer's Association that has two great chapters providing information on the disease and other information about Alzheimer's disease. They've provided us those numbers, and they are indeed significant numbers, and we can only expect those numbers to grow as time moves forward. Pennsylvania's ranking as the fourth grayest state in the nation is we have data that tells us that's not a temporary situation. That's a situation that's going to continue over time.
Are there more people experiencing Alzheimer's than in the past, or is it just a question of reporting it more?
I'm not sure of the incidence rate as far as is it growing faster or is it in comparison to previous years. But I would think that there's probably an increased incidence rate. Not a clinician or researcher here in my service as secretary, but I would think with the move towards earlier diagnosis, which researchers are enabling to happen, I think the diagnosis of the disease by primary care practitioners and others is leading to an increased number each year. And so it would probably be safe to say the rate is increasing. But you can't say whether the rate's increasing because there's actually more cases or more cases are being identified.
Right. I noticed that you've had a number of meetings so far with this committee, a couple in Harrisburg, State College, Scranton, Philadelphia, and Clarion. And Clarion definitely looks the smallest area that you're going to meet in. Do you expect anything different in Clarion than you've received at the other locations?
You know, the kickoff meeting of the committee and the regional meetings have provided us with a lot of valuable information. You know, having persons living with the disease speak to us about what that's like and what they believe is needed. Having family caregivers or relatives and persons who are living or lived with the disease since passed away. We've had providers of service everywhere from physicians to hospitals to nursing homes, assisted living facilities, home and community-based service providers, and others speak to us. We've had people that are involved in the creation of policy all speak to us about what's going on. And Clarion is indeed a unique meeting and a very important one. You know, when we consider the Commonwealth of Pennsylvania and we consider that, 48 of our 67 counties are considered to be rural, the dialogue that we're going to have in Clarion is a very real one. It actually came out of an exchange I had when I was up for a visit with the Area Agency on Aging in Clarion at an event that was promoting health and wellness. And a person in the audience asked the question you just asked. You mentioned that there'll be a meeting up in the Northwest. How is that meeting going to engage the conversation about issues faced by people living in rural communities? And I mentioned that we would want to do that. They asked me where we're going to have that meeting, and I mentioned a more urban area nearby. And they stated that it would be best to come to a rural community to have that dialogue about the lived experience of Alzheimer's disease. And so that's why we're coming to Clarion to talk about the very real issues that are faced by our fellow citizens who live in rural communities and who are living with Alzheimer's disease. That's what's going to be different about Clarion.
I think the service delivery is probably different in a rural area than it is in a more urban area.
I think you're right on that, Ron. I think when we look at access to services, right, people who may live a great distance perhaps from a place that provides care. When we look at maybe challenges with communication or outreach to the community, when we look at the characteristics of a population that may offer challenges. I think each of these, transportation issues and others, we know that there are some very real issues that impact how care is delivered. We also know, though, in some areas of our state that are rural, that also has been a great move towards collaboration out of necessity, that providers who share missions to serve a similar population have come together to determine ways to do more effective outreach and help people in need.
There seems to be a real emphasis with the aging operation in Pennsylvania to let people, if they're able to stay in their homes more for types of needed care as they age, and kind of, hold off on the nursing home full-blown type activity. So there seems to be more concentration in helping people stay at home longer.
That's important, I think. Thank you for that, Ron. I think that's important for a couple of reasons. I think it's important because if we were to ask our fellow citizens what it is they desire if they need care or if they are in need of care now, they would tell us they want to receive those services in the home and community. That does not negate the need for nursing home care. We know that there are fellow citizens who require that level of skilled care 24/7. But the focus on home and community-based service is responsive to what our citizens want and also what our citizens need. Our citizens can do better if they're receiving services in their home and community. It's a setting where they desire to be and where those services can have great benefit. And so the focus of the Department of Aging is to, our mission statement says, to enhance the quality of life of older Pennsylvanians by empowering the community, the family, and the individual. And we believe we carry that out through services that are targeted towards prevention and protection. When we talk about prevention in home and community-based services, we talk about the provision of those services that help assess what a person needs, develop a care plan for what a person needs, and then coordinate services in the person's home or community so they can stay there longer. That's an important thing to consider as we move forward.
On the Alzheimer's side, your committee that you're in charge of, you're to provide Governor Corbett, I believe next year, with a plan for dealing or increasing services for the Alzheimer's patients if needed?
Yes. So the executive order calls upon us to do several things. One is it asks us to look at the needs of the persons living with Alzheimer's disease and those who care for them, and to spell those out, to answer the question, what is the state of Alzheimer's in our state? Second is it asks us to look at the resources that exist. Pennsylvania is home to two nationally recognized research centers, one in Pittsburgh and one in Philadelphia, and an array of providers, including those here in Clarion County, who help people every day who live with Alzheimer's disease. What resources do they offer in terms of education and information and outreach? What resources do they offer in terms of hands-on care? And then we're asked to look at those needs and look at those resources and identify what may be an effective strategy for moving forward to help our fellow citizens who are living with Alzheimer's disease, and to present recommendations that support that strategy to our governor by February of next year. So that's the goal of the committee.
Is financing a concern for some of your possible recommendations?
Well, we always have to have a conversation about that very real reality of resources and how it's financed. And so both in terms of how we pay for the care that's needed or will be needed moving forward, but a conversation also about the economy of Pennsylvania and how Alzheimer's disease affects the economy. Something we may not think about. We can think about what are the true costs to our caregivers, the person living with the disease, and what are the costs that will have an impact on the systems of care in the Commonwealth. They're very real parts of the conversation. We also have to think about the economy as a whole. Many family caregivers who work are also caregivers of persons living with Alzheimer's disease. How does that affect the productivity and economy. And these are real issues that we also need to talk about.
Does Medicaid and Medicare enter into the picture?
Well, they would, right? So we know that persons who receive long-term care services and supports can be supported by Medicaid. I think a little over 200,000 of our citizens are Medicaid enrollees, and then for long-term care. And Medicare, it's about 2.3 million people in our state are enrollees. So we know it's a very real discussion that we need to have as to how do those government-based systems of reimbursement integrate with this issue of living with Alzheimer's disease. So that will be part of the conversation as well. You know, we have services that we provide now, for example, through the Medicaid program, through the aging waiver. The aging waiver looks at those who are eligible for medical assistance and may need a level of care in their home that is equal to what would be received in a nursing facility. We have to look to make sure we're doing the best we can with those dollars for persons living with Alzheimer's disease, and that will be part of the conversation. But we also have to look on the Medicare side. You know, that's the side where we have our greatest impact in terms of looking at how we care for people at the primary care level in a preventive way. You know, what is it that we can do for persons living now so they stay more healthy and well? Why there's not a clinically proven approach that says if you do certain things you can prevent Alzheimer's disease, we know that people who are more healthy and well have a propensity to perhaps have a lower incidence rate of Alzheimer's disease. So what can we do to help the Medicare population take advantage of those benefits that help them stay more healthy and well?
Generally speaking, by having someone take advantage of home care first, it is a cheaper situation or less expensive situation than a nursing home and that. So it's a win-win situation for everyone.
But there is a cost issue you're right. When you look at home and community-based services and you compare that perhaps a per diem or per day expense in a nursing home, you are looking at services that have a lower cost and can still have a high impact on meeting that person's needs and helping that person in the home, or perhaps a more cost-effective approach to care. We believe that, yes.
Right. Well, I was wondering if you could talk a little bit about some of the meetings you have, and obviously without naming names, some of the testimony that really caught your interest, some of the stories that stood out.
You know, we've had some, I'd say, some trends and some unique discussions at the regional meetings, and they've all been extremely helpful to the committee. Committee members come, and these meetings are more about listening than it is about talking to the audience. So it's more about what we can hear from our citizens. If they're persons living with the disease, caregivers, or those who are professional providers. And so at the meetings, we've heard some trends. We've heard a call for support of the family caregivers to allow the respite, which we offer now through our family caregiver support program, but we also offer through our in-home and community-based services. We've heard a need for education of the general public about Alzheimer's disease, education of those living with the disease and their family members or the people that are caring for them, education of professional caregivers, so everyone from the very valued certified nursing assistants or personal care assistants that help us provide those services in the home, both in the home and community and in facilities such as assisted living facilities or nursing homes, but also education of our medical profession and nursing profession and social work profession and all those that come in contact with persons living with Alzheimer's disease. So that's been a common theme of the meetings as well. We've heard, of course, a call for research, both supportive research that's ongoing now and research into the future that'll help us more accurately diagnose the disease, but also to help those people who are living with the disease. Ultimate goal, of course, of all who are involved in these discussions is that there's a cure. But we know we also have to be concerned about the care. And so I think that's a trend we hear in the discussions as well. We've heard also a call for, community-based collaboration. What's that mean? Well, one of the terms that's being used is dementia-friendly communities. What does that mean? How does a person live with Alzheimer's disease in their given borough, town, area? Their early stages. Are there things the community can do to help that person live a life as fully as possible in their community? And does that mean we have to modify anything in our communities? Or how do we provide those services we encounter as we live lives each day to someone who may be facing the challenges of Alzheimer's disease? I think that's another theme that's come up. You had a question, Ron?
Oh, I was just wondering, how does the community provide some of those services? Can you mention just a few of the services that might be needed?
And I think sometimes yeah, go ahead.
Oh, and I thought I've noticed some more younger people with cases of Alzheimer's lately.
Yeah. So how can a community, or how are they, or how could they do this? Well, some examples are we see partnerships between area agencies on aging, which are a great provider of those social services, those in-home services that are needed to help support a person. So transportation, nutrition, in-home services, personal care services, all very valued. And they do that in partnership with other providers in the community. That's an example of partnership that exists in a community to provide services to an individual in their home or their community. We also know there's partnerships that may start to exist, or at least there's calls for partnerships that may exist, let's say, between financial services and persons who are being cared for Alzheimer's disease. How do we help a person manage their banking and financial resources when they may be experiencing Alzheimer's disease or have been diagnosed at an early stage? That's a very practical example of something that somebody has said, gee, how do we either help them or protect them from, exploitation, those kinds of situations. So they're examples of community partnerships. Can there be a way to combine the best of adult daycare services, or how do we engage people who may be going to a senior center, who may be in the very early stages of Alzheimer's? How do we help them? These are all examples of community partnerships. How do we help with communication and transportation? Your second question was about people being diagnosed perhaps at an earlier stage or earlier age. And you're correct on that. And, there are conditions such as frontotemporal dementia and others that people at younger ages, in their 40s, 50s, are being diagnosed with Alzheimer's disease. And it just adds and helps resonate the call that we do something in the Commonwealth of Pennsylvania to help those living with the disease.
I noticed in your resume, which is very extensive, that you also come from a hospital background?
Yes, I do. Yeah, I was a hospital administrator for about 20 years.
So,
and then had a conversion to the field of aging, and sharing personally, that conversion was based on the hands-on care of my late mother, who had Alzheimer's disease.
Oh, I see. Well, how does that perspective as a hospital administrator for all those years exist with what you're doing now?
It's good. We all come at this, I say, when I meet at the regional meetings, either based on personal experience or professional expertise. And I think those years in the hospital shared a lot with me, but I guess, inspired me a couple ways. And it's been lessons that I've seen carried out in the field of aging as well. One is to realize that Alzheimer's disease is often accompanied by other complex illnesses. and we have to care for the person as a whole person. And how do we do that best? How do we make sure that as we're perhaps treating someone for pneumonia, that we realize they're also living with Alzheimer's disease? And how can a team-based approach to care among the nurses, physicians, social workers, therapists, and others that work in a hospital setting together, but also could and can do work in some situations in a non-hospital setting together to make sure the person's getting the best care they can that addresses all the situations they're challenged with, living with on a daily basis. So there's some of the lessons that I carry over, I think, from my hospital days to now work with many talented people, both at the Department of Aging, the area agencies on aging, and many providers, including those in Clarion County, on a daily basis.
You had mentioned your mother earlier. How long did you have to care for her with Alzheimer's?
Well, my mother, unfortunately, lived with the condition for probably about 8 years, and it progressed from early stage when it was just maybe some minor forgetfulness to a stage where she needed care 24/7 and received that care in a skilled nursing facility. And along the way, I faced the challenge many caregivers face of becoming educated about the disease and then seeking ways for care to be delivered. Utilized an adult day provider who was helpful while I still had to work and make sure she was in a place where she was safe and cared for and received services that were helpful to her and helped address her needs, but also engaged her as a person as her capacities and abilities changed.
Very interesting. You had mentioned earlier about there's some family situations where the adult children have to take care of their older parents with possibly Alzheimer's, but at the same time also have to raise their own children.
Yeah, that's right. Some people have called that the sandwich generation, right? That they're caring for their own families and children as well as caring for a parent. And we encourage those caregivers to reach out to their local area agency on aging for information and assistance. We also encourage them, if the diagnosis has been made of Alzheimer's, that they reach out to information sources such as the Alzheimer's Association. Besides gaining information, we also suggest they make sure they take care of themselves. You know, if there's an opportunity to arrange for respite or take a break from caregiving responsibilities, they should do that. They have a tremendous responsibility in that they become the key source of information and care for the person in their family.
Well, thank you for joining us today on Clarion Connection. Secretary Brian Duke, Secretary of Aging. The Clarion meeting is Monday, September 16th from 9:30 to 12:30 p.m. And I understand that people can submit comments in advance or attend the meeting.
They can. If people wish to speak at the meeting, they should give us a call. They can call 717-425-5115 to let us know. They also can use that number to make comments and suggestions if they can attend the meeting. People can also write to us at Pennsylvania Alzheimer's State Plan, 555 Walnut Street, 5th floor, Harrisburg, PA, 17101.
And you're encouraging anyone that needs disability accommodation request to notify you in 3 days in advance.
Yeah, let us know that in advance. One meeting, for example, we had persons who live with a challenge to their ability to hear, and so we needed to bring in interpreters and make other accommodations. So please let us know in advance if that's the situation.
And they can also contact you through email at...
They can at ALZ State Plan, all State Plan at pa.gov.
Well, thanks again for joining us. Good luck with your important work here, and hopefully you'll submit a plan that the governor will, react to, and we'll move forward.
We're hopeful, and we're grateful to the citizens for participating in this process.